I'm Dr. Madeleine Attridge. I'm a GP from Barry with out of hours experience, and I've been asked to talk to you today about managing joint problems by remote consultation. So first of all, we're going to start with how to manage back pain. Now, this is quite a common thing that we've had to deal with in the out of hours setting, and outside of that hour setting as well, with patients phoning up in sort of acute onset back pain. Sometimes they're demanding a home visit because they can't get out. They don't want to come down to the surgery because they're in so much pain. And actually this one is often something that can be managed over the phone, providing they don't have any sort of red flag features. So first of all, I always check that I'm speaking to the correct patient and check their date of birth. I introduce myself after confirming that I've got the correct patient, because their relative or friend may not know that they've asked for a doctor consultation. It's often preferable to speak to the patient themselves as well, because relatives sometimes give a bit of a different history and can't always answer all the questions specifically. So it's very important to take a detailed history. So I want to find out exactly how it occurred. Was it that they've had a sort of significant injury or trauma, in which case I probably can't deal with this over the phone, or if it's just as simple they've been bending, twisting or lifting something, or they've been out in the garden for quite a while, or it just occurred for no reason, that's not going to be a red flag in itself. So those are your simple sort of, low back pain injury signs. So the next I'm going to find out how long it's been lasting for. Has this been going on sort of less than 4 to 6 weeks, in which case I'm less concerned, or if it's been going on a couple of months and it's getting worse, then I'm more concerned, is there something underlying going on. I'm going to ask about how severe their pain is, what they've tried for their pain, where exactly is the pain. It's also very important to sort of document all the red flags. So those who have a previous history of cancer, or the very elderly, where there might be osteoporosis going on, those with you document whether they've had night sweats and weight loss, if it's been going on sort of more than a month. You always want to check for things like bladder and bowel disturbance and persistent numbness or weakness. They may sometimes get a bit of intermittent numbness when they've got sort of a mild disc protrusion, but I'm not concerned unless it's persistent. Then you need to think, is an examination going to add anything? Do I need to bring them in? So those cases where it's, you're suspecting an osteoporotic fracture, or whether you're suspecting malignancy, or where they've had significant trauma or persistent weakness, then there is going to be a value. But most cases where it's your typical patient phones up and they've pulled their back just from like bending over to pick something up, and they're in severe pain and they can hardly move with it, but they have occasional numbness in one leg, but it comes and goes. Those are just your simple back pains that you can manage over the phone initially. So initially I'd sort of suggest that they make sure that they're taking adequate analgesia. It might be appropriate to rest in the first day or two, but after that they need to really get up and moving and not lie down for prolonged periods, because that will make it worse. I tell them to take their analgesia before they get up in the morning, say 30 minutes before they get out of bed. Otherwise they're going to find that bit of the day very hard. Then I often suggest sort of back pain exercises that they can do at home, and I'll either text this to them or give them the link, and that's on the Chartered Society of Physiotherapy. They've got some good ones on there, but they've also got some on versus arthritis, or I might even suggest that they do some Pilates videos and things like that, just to sort of change the way they do things. The next thing, I often sort of talk to them about why I haven't requested an MRI or an X-ray, because patients often think, that will give them sort of the answer of what's going on. So I sort of describe to them, well, actually an X-ray, that's only if we're suspecting malignancy or a fracture. It's not going to tell us what you've done to your back otherwise. And an MRI might show that you've got a mild disc protrusion, or it might show something else, but initially we're going to go for conservative management anyway, so it's not going to change what we do. So and sort of say we do those investigations when they would change our management. And then lastly, it's important to safety net that, if they develop any of those red flags that you've mentioned, if things don't improve, if it goes on a long time, then they do need to ring you back up and have another sort of telephone consultation with a view to being seen if needed. Okay, so just to recap, it's important to check you've got the correct patient, take a very detailed history because you're not potentially seeing them face to face. Make sure that they've got adequate analgesia, that they can keep moving, and give them something to work on so they feel that they're actually doing something for their back pain.